Hello and welcome to our show, Joy in Our Town. I am your host, Ann Farrell Tata, and I am delighted to welcome today Dr. Kevin Bonner. Dr. Kevin Bonner is an orthopedic surgeon with Jordan Young Institute, and he actually he specializes in sports medicine, specifically in arthroscopic surgery. And we are going to be talking today about the different sports injuries between young athletes and the older athlete. So, Dr. Bonner, welcome today. Thank you for being here with us. And tell us a little bit about what you do specifically, because there's a whole range of orthopedic surgeon specialties. And tell us what you do and what a typical day is in the life of Dr. Bonner.
There is a whole range of fields in orthopedic surgery. Everyone's gotten so subspecialized these days. So specifically what I do is more focused on patients, both younger and older, who have sports-related injuries, but not always sports-related injuries. A lot of things that we call sports medicine does not necessarily have to be related to playing sports. And what I mean is, there are certain things that occur to people, such as having a rotator cuff tear, that, for instance, you can tear your rotator cuff very commonly throwing out the garbage or doing something like that. So even though we describe it as being sports medicine, that's just evolved in the field of orthopedics, because guys who take care of sports-related injuries also tend to do most of the arthroscopic surgery. And arthroscopic surgery has evolved to the point where a lot of injuries can be treated arthroscopically, and that's why even we take care of things that are non-sports related. So it can be confusing to say we just do sports medicine because sports medicine really now entails a lot of different things. But for instance, me specifically, I tend to focus mostly on knee and shoulder injuries, as well as some elbow injuries. In part, those are the more common joints that are affected in sports, both in younger people and older people. So there's really a spectrum of injuries that we see in orthopedics that I take care of, ranging from things in the knee, such as meniscus tears, ligament tears, ACL tears, to the shoulder, such as labral tears and rotator cuff tears. So there's really a spectrum that we see in the office.
So, and you know, you're a surgeon, but you're saying also you don't always do surgery. Oftentimes you see the patient, treat them, maybe send them to physical therapy, or send them on their way. So there are times when they don't need surgery.
Oh, absolutely. In fact, a lot of people think just because they're coming to see me they need surgery, but it couldn't be further from the truth. A lot of people that I see never need surgery. In fact, very often we will try to treat people without surgery first. And it really depends on the injury itself. Some injuries, and it can be related to the age of the patient, have a very good prognosis for being treated without surgery, versus other injuries that do not do very well when they're treated conservatively. So you're absolutely right that a lot of people who come to see me often do not need surgery. A lot of them can get better with non-operative treatments, such as physical therapy.
So that's, let's talk a little bit about the younger athlete first. And I definitely want to talk about the weekend warrior, but first let's talk about the younger athlete. And can you talk a little bit about the single sport athletes and versus, you know, the ones today versus when we grew up?
Right. What we're definitely seeing, unlike when we grew up, where quite honestly, we went from football season to basketball season to baseball season, and honestly, I grew up in a small town, so really all the kids played all the sports together, so we couldn't really focus on one sport. Well, today, as you well know, a lot of kids are getting so focused on single sports that that's all they play 12 months a year. Now, that's okay for some sports, but what we're seeing is a lot of overuse injuries, such as in baseball in our area. The young athletes who are throwing, who basically throw so much during the year that they don't give themselves a chance to recover. And we're seeing a tremendous number of overuse injuries in young kids. In fact, it's estimated that anywhere between 50 to 60% of injuries in younger kids are overuse injuries, and basically can be prevented by decreasing their amount of time in that activity, or at least cross-training and doing other things. So that's absolutely correct.
I'm so glad you brought that up, because that is a huge problem for parents of these athletes. The coaches, oftentimes, they only want the child to do one sport. And so it's hard you have to advocate for your child, I guess, to insist that they have some cross-training. Right,
and that's the problem. I mean, it is a problem, honestly, because clearly kids get better and better when they focus on one sport in terms of that activity. The problem is that depending on the sport, Okay, some sports are much more likely to contribute to overuse injuries, such as pitching and throwing in baseball, versus some other sports, quite honestly, are not. Even in this sport of baseball, for instance, hitters tend to not get overuse injuries. So you can often hit all year round and just get better and better and better, versus if you're a pitcher and thrower, that the more you throw, that takes a toll on your elbow and on your shoulder, and over time, that can predispose you to getting an overuse injury. So it's a dilemma, though, because quite honestly, all the kids and their parents and coaches want them to get better and better and better, but they're almost going through this, what I call Darwinian challenge, in that, yes, you'll get better and better as long as you avoid an injury. But the problem is so many kids are getting knocked off by injury that very often the ones who are left at the end or the top of the pyramid are the ones who got through without an injury. And quite honestly, it is often luck in a lot of these kids.
That's so frustrating. And the other thing that I have seen is there are a lot of sports that really complement each other, like tennis and soccer. So if the coaches would allow, or if the parents realize that there are these sports that if they did, they would not only be cross-training, but they would also be, improving in their sport by doing these complementary sports.
No, absolutely, because cross-training is very valuable for a lot of sports, because we will see that kids can acquire problems, and even young adults will acquire problems with their upper extremities or lower extremities, for instance, getting contractures of their shoulder where they get too tight in certain areas as a result of throwing. So cross-training and doing other things definitely can help. The problem is that a lot of kids, quite honestly, in our society, especially in a bigger area, it is so competitive that a lot of kids are just not good enough to play multiple sports. So it's a little different if you grow up in a small town versus a big city or a big town, where a lot of the schools are so competitive, it is just quite honestly difficult to play multiple sports.
Right. Yeah, that makes sense.
Yeah. So, so that's where the problem is, and there's not an easy solution. But clearly, I think we all have to take responsibility from both a parent standpoint, physician standpoint, coach's standpoint, trainer standpoint, in terms of protecting the kids, in terms of not allowing or at least decreasing the incidence of these overuse problems.
Right. When the ones that I feel like we hear the most about are the ACL and the meniscus tears. And why is it that they happen more often in girls?
Well, I'll tell you, it's funny. ACL tears are more common in girls, probably anywhere in the range of 6 to 10 times more common, although that's controversial. It depends on what study you read. But that's really multifactorial why. From a neuromuscular standpoint, girls tend to, for instance, in basketball and volleyball, land a little bit differently than guys do. In terms of their notches, which is the space for their ACL, they tend to often be more narrow. Well, not only is the notch more narrow, but often that means their ACL is smaller, so that can contribute. But it's so multifactorial in that we even see some of the, there's a hormonal influence on the ligaments sometimes. So it's multifactorial, but clearly girls are more common in terms of their incidence of ACL injuries and subsequently also meniscus injuries than young boys.
Oh, so that's more common in young boys
No,
than
no, 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 no. So very often, when someone tears their ACL, they will often have a concomitant meniscus injury at the same time.
I see.
So that if a young girl, for instance, tears her ACL playing soccer, it's very common to also tear the meniscus as well.
Oh,
and that can be for a young boy or a young girl. And it doesn't have to be a young boy or young girl. It can be older,
Right.
athletes as well.
But they usually happen together.
They can often happen together. And once you tear your ACL, you're actually more likely to tear your meniscus subsequently, especially if your knee is unstable. And that's part of the rationale, actually, for why we consider doing ACL reconstructions and surgeries, to actually prevent recurrent injury to the knee, specifically meniscus injuries.
Now, ironically, just last night, I happened to see a friend of mine's daughter, and she's 15 or 16, and she said she tore her ACL 2 or 3 years ago, but they waited until her growth plates, until she stopped growing before they did the surgery. Is that a common
that used to be more common, quite honestly. There's somewhat of a fear, and justifiably so, with interfering with growth in the growth plates. So Our philosophy, however, has changed over the last really 10 or 15 years, in that what we found is that the risk of doing nothing is probably a lot greater than the risk to growth plates with some of the more contemporary procedures that are done. And what I mean is that what we found is if a young kid, even if their growth plates are open, if you allow them to have an unstable knee, the risk of injury to their meniscus or their cartilage is so great, you're really better off taking somewhat of a risk to the growth plates and actually trying to perform a reconstructive technique than treating them without surgery and just bracing them for years. So if you really go to most current forums or courses or lectures on the current contemporary treatment of ACL injuries in younger kids, it's really not advocated to just wait anymore. We've tended to get more aggressive due to the fact that there's a significant risk to waiting.
Now, what is the long-term prognosis for these young athletes that this happens in their injuries? What's going to happen to them 10 years down the road?
It is unfortunately not a great prognosis, and what I mean is that we're trying to make their knee as good and as stable as possible. However, we know that unfortunately, as you follow these kids and young adults out further and further and further, that there's a very high incidence of getting arthritis as time goes on. So I tell not only the kids, the parents, as well as, again, young adults, but it's not just young adults. I mean, it's older adults as well. I'm getting older, and I'm certainly a weekend warrior. I'm not a young kid by any means anymore. And the second you tear your ACL and injure your knee is more likely to get arthritis than if you never hurt your knee. So the problem is that we do everything we can to prevent the progression in terms of trying to protect the meniscus and restore the kinematics or the function of the knee. But despite our best efforts, we know that these knees are still at high risk, and very often they will get arthritis as time goes on. And that is a major problem. So it is very common to see ex-high school, college soccer players at the age of 40 years old who have severe arthritis.
That is very discouraging.
It unfortunately is, and you don't even, when you're on the soccer field or football field, it's one of those things you don't like to talk about.
Right.
But I will tell you that, especially if you see a lot of these ex-pro athletes, it never gets talked about how a lot of them need knee replacements in their 30s and 40s and early 50s. It just doesn't go reported very much. It's one of those things you don't like to talk about, but unfortunately, it's one of the problems with these younger, these sports injuries in younger people, in that it does take a toll on that joint. And despite trying to put that joint back and make it functional, very often once that joint suffers a severe injury, you can't go back and make it normal again.
Right.
So that is tough, and unfortunately, a lot of these athletes who suffer injuries will unfortunately have to deal with arthritis at a young age.
Yeah, and you're right, you don't hear about that at the coaches meeting.
No, you don't.
Well, thank you so much for being here with us today, and we are going to take a break, and when we come back, we're going to address the weekend warrior, those baby boomers that are exercise craze that I'm sure you see a lot of those patients
like you
as well.
and I.
Yes,
right.
exactly. But we're here with Dr. Bonner, and we'll be right back to Joy in Our Town. Thank you. Welcome back to Joy in Our Town. I'm Ann Farrell-Tata, your host, and I'm delighted to be here with Dr. Kevin Bonner, orthopedic surgeon with Jordan Young Institute. And we are talking today about sports injuries in the younger athlete and also the weekend warrior, the older athletes. And as we switch gears and talk more about the older athlete, can you differentiate between the different injuries that you see with the young athlete versus the older athlete?
Absolutely. There's a different spectrum of the abnormalities and injuries that we see in kids and adults, and not that there's not overlap. Of course there's overlap in terms of, for instance, as we were talking earlier about ACL injuries. I mean, we see that, in a 13 or 14-year-old, we see that in a 50-year-old or 60-year-old. And the irony is that weekend warriors are getting older and older. So we used to say, years ago, once you're over the age of 40, oh, you're too old for an ACL. I mean, quite honestly, I see people who are 60 who are more active than people who are 18 years old. So really, age shouldn't be the primary factor. It should be certainly a consideration, clearly, But I think you have to look at everybody as an individual in terms of how active they are and what they need to do and how much function and stability they need to participate in different sports or recreational activities. So that being said, there are some things in kids when they sustain an injury that has a relatively poor prognosis for getting better without intervention versus an adult. And I'll give you an example. When a kid dislocates his shoulder, let's say wrestling, at the age of 18 or 19, there's a very high chance that once that kid's shoulder dislocates, and it's very often associated with a labral tear on the front of the shoulder. Basically, when their shoulder dislocates, very commonly you get something called a Bankart lesion, which is just a word for where the labrum tears off. And kids have a very high chance of having their shoulder recurrently dislocate. So once a kid's shoulder dislocates once, it's much more likely to continually dislocate or slide in and out. We call that subluxation. Now, if that same injury occurred in a 50-year-old, very often the 50-year-old is not going to recurrently have shoulder instability. Again, not that it never happens, but it is much, much less likely for a 50-year-old to have his shoulder recurrently dislocating. In fact, when a 50-year-old dislocates their shoulder or a 60-year-old dislocates their shoulder, you have to be more worried that they may have torn the rotator cuff at the same time. So you can have the same exact injury mechanism, you can have the same injury, but actually in the end have to worry about two different problems. In the kid, you have to worry about recurrent dislocations where you may have to go in and fix their shoulder so that it doesn't dislocate. A young kid is very unlikely to tear his rotator cuff. You never say never, but it's unlikely. Versus an adult who's much more likely to tear his rotator cuff, and that could be their biggest problem after having their shoulder dislocate. So that's just one example of differentiating, the same injury between a kid and an older adult.
Right, and you're seeing both, and you're taking care of both of those.
I do. In my practice, I tend to see mainly high school kids on up. Through the Weekend Warrior, and again, people are getting older and older.
Right.
A lot of the rotator cuff tears that I fix are people between the age of 50 and 70. Not that everybody who's older who tears the rotator cuff always needs surgery, but it's the older group of people who tend to get rotator cuff tears. The younger kids who get smaller tears in the rotator cuff tend to be baseball players that often don't need to be fixed, but because they tend to not get what are called full thickness rotator cuff tears.
Along those lines, can you explain the difference between a rotator cuff tear and impingement versus bursitis?
Sure, absolutely. So, in fact, let me show you a picture. There we go. So basically, just looking at the shoulder anatomy, this is a picture of a shoulder, and this is a picture showing impingement syndrome. So this bone is called the acromion, this is the rotator cuff, this is the bursa, and here's the joint. Impingement syndrome is something that is very, very common in people, especially as they get into their 40s, 50s, and 60s. And basically, when you lift your arm up, most commonly, you tend to get this impingement or compression under the acromion, and it basically pinches and rubs on the rotator cuff and the bursa. Well, what happens over time with impingement syndrome is that if it just continues, people can go through phases where they start off as having tendinitis, but then they can get partial tearing and full tearing of the rotator cuff. So basically, that's simply describing impingement syndrome. And what happens is that the final stage of impingement is that after rubbing and rubbing and rubbing, that rotator cuff gets weakened so that even with something like throwing out the garbage, you can tear the tissue because it's weakened significantly. So here's a picture just showing a tear in the supraspinatus, which is one of the rotator cuff tendons, and that's the most common tendon that tears. So very often when we treat somebody with impingement syndrome or a rotator cuff tear, most of these patients are treated arthroscopically now, where we'll actually go in and shave down the bone to open the space, take out the bursitis, we'll evaluate the entire joint, and then we'll fix the rotator cuff at the same time. So impingement syndrome is very, very common, does not always need surgery. So we'll look at an individual, we'll look at various different things that come into play regarding their prognosis for getting better without surgery, we'll very typically start off almost always with conservative non-operative treatment. And then depending on the status of the rotator cuff, that will often over time dictate what we do. Or, of course, if they don't get better with conservative treatment, that's when we discuss operative interventions such as doing arthroscopic surgery.
Okay, now I know everyone always talks about stretching, but really, how important is it to stretch before you, and that at any age, whether it's a young athlete or the older athlete, is it really that necessary? If you're working out every day, you're running every day, you're doing weights every other day, how important is it?
So stretching can actually be very important regarding your muscles. People will tend to get tight as we get older and older. Our hamstrings get tighter, our shoulders get tighter, all of our joints get tighter. And that gets back to the point regarding when I said earlier that as kids, we tend to be looser, more flexible. And that's part of the reason why when a kid dislocates his shoulder is more likely to keep coming out than as you get older and older, our joints get tighter and stiffer, and you tend to not recurrently dislocate. Well, stretching, though, is absolutely important, and it's not just in adults. We see it in kids sometimes who have, for instance, very tight hamstrings. When you have very tight hamstrings, that can contribute to getting pain under your kneecap and things such as that. So that's why we'll do stretching exercises as part of physical therapy in an effort to help somebody who has certain types of knee problems or knee pain. In the shoulder, same thing. We've recognized that baseball players and throwers, for instance, will get very tight, what are called posterior capsules, the back of their shoulder. Their joint will actually get contracted and tight, which will throw off the mechanics of their shoulder, and as a result, they're much more likely to get both shoulder and elbow problems as a result of it changes the mechanics. So very often when we see a pitcher who has a tight posterior capsule, the first thing we talk about is not surgery. The first thing we talk about is the right types of stretching that you're supposed to do so that we can prevent you going to surgery. So stretching is very important.
Now, you were a baseball player at Georgetown University. Did you have, what position did you play?
I did pitch
you
back
did pitch.
then.
Did
yeah.
you have any trouble? Did you have, or is this...
I hurt my arm, actually.
Oh, you did?
Mm-hmm.
Is this
yeah.
one of the things that made you want to go into orthopedic surgery?
It is. It is. I actually loved sports growing up. So in part, it was just not just baseball. I loved all sports. And, you know, I used to play football, basketball, you know, even before baseball. But clearly that's what got me interested. I did get hurt. I hurt my arm. I didn't know enough back then to understand the anatomy, of course. It wasn't until medical school and beyond that you really sort of understand what happened to you. And I'll be honest with you, back then, we didn't know nearly as much as we do now. I mean, we didn't utilize MRIs like we do now. We didn't understand injuries like we do now. I mean, it's funny, you know, what you hear about years ago, people saying, well, you know, did you have any history of knee problems? And people will say, not really, but I had this old trick knee from back in 1965, and we know that there's no such thing as a trick knee. You know, you probably had an ACL tear. It's just we didn't have MRIs, and it wasn't really diagnosed as an ACL tear. So there are a lot of, you know, athletes, I'm sure friends of ours, and both you and I, who had injuries over the years that if you saw somebody now, you would probably have a little bit better diagnosis than if you were diagnosed 30 years ago. And it was to no fault of the physicians. It was just that we didn't understand as much back then as we do now.
That's, speaking of the MRI, so just because the MRI says something is wrong doesn't mean you need to have it fixed. I mean, you could have a trick knee that, that you made, like as you were saying earlier, you opt out of surgery. Right.
I mean, that is one thing. It's funny nowadays, the general population, the public, everybody knows about MRIs. Everybody knows when they watch NFL football or college football on, you know, Sunday or Saturday that when a guy gets hurt, they're having their MRI, and everybody's going to find out by the 9 o'clock news what happened to the guy because of his MRI. And MRIs are so important. I can't tell you how, you know, valuable they are. I mean, I probably look at, honestly, 20 to 25 MRIs a day at least. And I think it's very, very important for the orthopedic surgeon to be able to look at the MRI. And I don't want to say, of course, just as good as the radiologist, but I think it's very important for us to be able to look at our own MRIs to differentiate with the patient what's a significant tear and what's not a significant tear, what is just age-related versus non-age-related, or what's a normal variant and what's not a normal variant. because within knees and shoulders, for instance, there's a lot of normal variance, especially in the shoulder, that does not necessarily have to be fixed. Or there's a lot of just age-related degeneration that occurs that does not necessarily need surgery. So when I see somebody over the age of 45 or 50 and their MRI says they have a labral tear, a lot of people have labral tears over that age. In fact, a lot of Major League Baseball players have labral tears that don't need surgery. So it is very, very important to look at the MRI and appreciate what's causing the pain and what does need to be fixed and maybe what doesn't need to be fixed, because what you don't want to do is maybe fix something that doesn't need to be fixed, and then it actually makes the recovery a lot harder and a lot, more difficult.
Well, Dr. Bonner, you have been a wealth of knowledge today, and I, again, cannot thank you enough for coming on our show and talking about these injuries and differentiating between the different ones. And I'm sure some of our viewers are going to want to be able to reach out to you, and I'm sure they're going to have more questions, so they can reach you at jordanyounginstitute.com. Is that correct?
Correct. That's our website.
Okay, jordanyounginstitute.com. And I want to thank you for being with us today, and I want to thank Dr. Bonner for joining us, Joy in Our Town. And I also want to remind you that our show can also be seen on our Facebook page. We have a facebook.com/TBNVA. Thank you so much for being with us, and have a great evening.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telethon dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.